Welcome to our intro to corporate services at Adjust. So, at Adjust, we are very, very lucky to have a number of corporate partners. But obviously, it's important that each of you understand who they are and what we do for them. So, what we're going to go through today is just an overview of who our corporate partners are and a couple of things to know about what we do with some of our clients when they do come through from these places, including our pre-employment physical assessments, our early intervention programs, and our on-site staff wellness programs. All right. So the first one and the biggest one is Village Roadshow. So Village Roadshow is the company that oversees Wet n Wild, Movie World, and SeaWorld, which is pretty cool. So for Village Roadshow, we provide pre-employment physical assessments. And so these pre-employment physical assessments are assessments that their staff members have during their recruitment process for anybody that's being recruited to a mildly physical role. And so these are staff members that work at SeaWorld, Wet n Wild, Movie World, or SeaWorld Resort as well, that have physical components to their job, which is pretty much anyone other than an office worker for these places. The next one is Stratco Queensland. So Stratco is the organisation, very Australian organisation that does steel and metal work. So typically what most people know Stratco for is sheds. So if anyone needs sheds, we have a good arrangement with Stratco Queensland. We provide on-site staff treatment. So an on-site staff wellness program is what we call, and we provide that up at their Yatala production sites. We'll go through exactly what that is in a moment. But that's what we do for them. From time to time, we also see any of their injured workers at the clinic as well, instead of them going under work cover. We also have an arrangement with Avanti Line Marking. So Avanti Line Marking is an organisation that does the line marking on the roads locally through Queensland. They have a warehouse up in Yatala. So for Avanti, we do pre-employment physical assessments, either for somebody who's applying for a new job there or pre-employment physical assessments for somebody who's returning to work after a serious injury. We have also done some on-site manual handling training at Avanti in the past, and we do that almost every year. And then we also have an early intervention program going with them as well, which is basically if somebody is injured, they come for an assessment and treatment with us in the hope to avoid a work cover injury, which is pretty cool to have as well. Very similarly for Riviera Australia, which is just around the corner, their boat building company is just down at the Riviera area around the corner from Adjust in Coomera. So for Riviera, we provide the early intervention program to their Coomera production facility staff and any contractors that work out of there. So again, that's where if people are injured at Riviera, they just come in straight for treatment as a priority to avoid a work cover claim. For a Visi board, very similar. They will also they are the company that creates all the cardboard boxes, pretty much that you see in the whole wide world ever. If you look at any sort of cardboard box on the side, you'll often see a little Visi stamp. That means that their cardboard boxes come from one of their Visi factories. They also have a Yatala warehouse site, and so they utilise us for any pre-employment physicals, again, for if somebody's applying for a new job, but also if they're returning back to work after a significant injury. And they will from time to time use us for early intervention of injuries as well. They do have a different physio on site that provides an on-site staff wellness program, but certainly if they're too injured to attend work, they will generally be referred to our clinic for in-clinic sessions. Okay, so to give you a bit of an idea of what our on-site staff wellness programs are, so essentially what that is where we have an arrangement with these organisations that one of our staff members will attend the workplace for an agreed amount of time each week or fortnight or month, whatever it is, depending on the workplace, to consult with any injured staff or staff that are having pain. Basically, what happens is we go there. So, for example, at the moment, we're running a Stratco staff wellness program. So, each Wednesday afternoon from 12 till 4, one of our physios will go there and treat clients back to back for 30-minute sessions in their little first aid room. In those sessions, basically the therapist completes an assessment, performs some treatment, but really the focus is on giving advice on how to manage and avoid the problem in the first place. So very much corporate physio style. We definitely do some hands-on treatment so that somebody gets relief straight away, but it's really important that we give them home programs and advice or modifications or recommendations to help avoid them having this problem come back again and again. And then what happens at the end of that session of treating is the therapist completes a little handover of the staff that were seen on that day to the contact person. So in Stratco's case, it's their health and safety manager. And we just let them know who we saw, what their diagnosis and mechanism of injury was, any advice that we gave in terms of work modifications or investigations that might need to be made into incidences that have happened, any recommendations on further treatment required, in particular for anybody who might turn into a workplace injury. It's important that we manage that as soon as possible. And we just give them a bit of a summary of the treatment that we provided. So the whole purpose of this is so that staff can access physio on site at work. And the reason organisations like to do this is it helps reduce work cover claim injuries. So if we can capture nip an injury in the bud or a pain in the bud before it becomes a big injury that becomes recurrent for the person, then it helps the organisation out a lot. Obviously, if we can stop someone from having to leave work to be able to access physio, that obviously keeps somebody at work for longer. So it reduces what's called their lost time due to injury, which is definitely something that organisations love. The other thing they like about it is just it boosts culture. Like there's nothing better than being able to go to work and access health services. So often under these on-site staff wellness programs, you'll see people that have non-work related injuries as well. Some people that just want a little bit of hands-on work because they're a bit headachy, those types of things. So it's a really nice thing for organisations to be able to offer their staff from time to time. Typically, it'll be for a fixed contract. So with Stratco, we tend to do it twice a year for a couple of months at a time. And there's other places where we've done it on an ongoing basis for many years until the contract sort of comes to an end. If you're ever expected to do an on-site staff wellness program, we'll obviously give you a lot more training specifically on that site when it's going to happen. But this is just an introduction into these programs that we offer. So this is a good example of just a little handover that would be given. So it would just, the blacked out parts of the client's names. This is an example one that was sent to Daryl from Stratco, the health and safety manager. So it just says, what they came in with, what their diagnosis is, what we did, what our recommendations were, and whether they need any future sessions. So if we're in the middle of doing a staff wellness program, those weekly sessions would probably happen within that staff wellness program. But say if we were coming to the end, those 3 weekly sessions would then be booked in at the practice for in-clinic sessions. Also, if there are any clients that are requiring twice a week or more intense physio, or if they're requiring a GP advice, scans, those types of things, then often we would choose to just open up a work cover claim. So that's our staff wellness programs, just as a bit of an introduction. So like I was saying, we typically at the moment we're doing that for Stratco, and we've done that for a few organisations in the past. Early intervention programs are a little bit different. So this is where somebody, when they're injured at one of our corporate partners at work, they would book their staff member in on the day for a physio assessment, diagnosis and treatment of an acutely injured staff member. And that happens in at the clinic. So the aim of this is to basically get on top of any injuries that are happening very, very early and providing very tailored treatment of those injuries to the client as early as possible. The reason organisations really like this is if they can get people in on the day, it very much so reduces the number of work cover claims that get submitted, which actually saves the organisation a lot of money in terms of their work cover excess. So remember, I was talking about work cover being an insurance company. If an organisation has a lot of claims throughout the year, they actually have to pay a bigger excess in the following year. So wherever they can reduce the number of claims that they are putting in is actually going to save the organisation a lot of money. So what a lot of organisations choose to do is basically invest that money in an early intervention program. So there's a win-win benefit there. Their staff members get early treatment on the day for any injuries, and at least that money goes towards helping the client get better as quickly as possible and get back to work as soon as possible. But also, instead of that money being spent on a great big excess because they've put in so many claims, it can reduce that excess down. Workplaces also like it because it reduces the lost time due to injury, like I was explaining before. We know that if we do an early intervention, we facilitate a fast and safe return to work, and it is within our control, so it's a lot easier to get someone back to work in some form of capacity without having to rely on a GP to do that process for you. It also allows for workplace health and safety practices to be worked on with physio input as well. You know, when we're out there assessing staff members, we can give very detailed information to the work health safety officers about why these injuries are occurring. And a good workplace health and safety officer will use that information to be able to prevent that from happening again. And then improving business culture. These organisations love being able to provide this to their staff. They don't have to provide it; they choose to, and so that it's a really nice thing for the staff to be able to access these sorts of things through their workplace, as you can understand. So essentially what the process is, obviously the staff member would become injured at work, they'd report it to their manager. The manager rings us up straight away and books them in for an early intervention session. The therapist, the practitioner performs their initial consultation and delivers any treatment that's required. And then on the day, the therapist must inform the workplace via a report and a phone call, or if the person doesn't answer their phone, they can send what's called a Voxer, which you'll get training on a Voxer later in your orientation. And in that report, it covers the recommendations that you're going to give going forwards on their work capacity, their duties, any modifications that need, any further treatments that are required, and any scans or medical intervention required. And there's a report template for this as well, which we're going to go through. So that's an overview. So staff member injured, they get booked in, we see them, we provide a report on what to do next. Now, from a practitioner point of view, and this is important for admin to understand in terms of the session counts as well, but from a point of view of providing early intervention recommendations, what you need to be thinking in your head as the practitioner is if the client can likely be treated and back to some form of work in 6 sessions or less, this is where we would recommend that they just continue paying for further treatments. Okay, so this is where the organisation would cover those 6 sessions or whatever's required in order to get the person back to work. Now, if the client is likely to require more than 6 sessions to get back to work, then we need to let the organisation know that that's going to be the case, because it may be more favourable for the organisation to actually put in a work cover claim rather than pay for in excess of 6 sessions. So what we know from research is that if we can get people better in 6 sessions or less, then it actually is going to work out cheaper than the increase in their excess. But as soon as we start going past that 6 sessions, it then actually is cheaper for them to use the insurance that they pay for. Okay, so if that doesn't make sense to you, make sure that you ask questions about that, because you do, as the practitioner, need to get your head around that. And so from an admin perspective, what will happen is that recommendation of the number of sessions will go on the report. And then we just need to make sure that we do get approval from the organisation to continue sessions if that's what's being recommended. If you need any scans or medical intervention, then that means we have to open up a work cover claim. We can't be sending people to GPs privately. As soon as it hits GP level, we have to open up a work cover claim. So if you're suspecting, for example, that somebody's ruptured their ACL or fractured a bone, then the organisation really doesn't have a choice. They need to open up a work cover claim in order to get the scans that are required. So again, you just need to communicate that to the contact person in the report, but also in your phone call that you'll make, which we're about to go through. So the early intervention form, again, there's a template in letters here. So early intervention form is highlighted here. This needs to be completed at the time of the appointment, or if not, shortly after, sort of within an hour or two of the appointment. You need to email it to the Physio2Just email for sending immediately, because these organisations will expect that of us. They are priority patients. This is what the report looks like. So it'll have the staff member name, date of birth, contact details, examination performed for, and you just need to put the organisation's name. So to be Riviera or Stratco, Visi, whatever the workplace is called. And then the supervisor or contact's name goes in there. Now, in your onboarding pack, there is information on these corporate services and who the contact is, so that you don't have to remember them. So if you forget that, just refer back to your onboarding pack. You need to put in what your injury or diagnosis was at the top here, and what the mechanism of injury was. Then you would summarize the treatment that you provided, how many sessions you require and over what time frame, and what that treatment is for. So in this case, Braden's recommended 3 to 4 sessions over 2 to 3 weeks to continue treatment on their injury. This section here is about any modifications that you require for the person to be at work. So keep in mind, similar to work cover, it's important that we try to have the person at work, even if it means that they're doing very little. We know that by having that person at work, they're much more likely to make a good recovery compared to if they're sitting at home doing nothing. So light duties recommended. So in this case, Braden's recommended no lifting until this date, or when a review has been completed. The when could be when can lift 10 kilos successfully overhead. So it could be an outcome measure there as well. They've also recommended bending and twisting as tolerated rather than restricted altogether. Whoop. Cool. And then down the bottom here, any additional comments or future considerations? And Braden's just popped in here that if there's no improvement, we may be required to rule out any further damage. So that's basically Braden saying, I need to review it in a couple of days' time, make sure it's responding the way that it's supposed to. But if not, we'll let you know. And then putting your details down here. So this goes across the organization. So you'd fill this out, email it to front desk so it gets sent, and then you would ring, in this case, Adam, so whoever the contact is, and basically just run through what this report is. Our corporate organizations will expect a verbal handover. If you can't get on to them on the phone, then a Voxer is the next best thing, which is a voice message. Which we'll teach you how to do in your orientation. So this is similar to what the phone call would be. So it'd be something along the lines of, hey, Adam, it's Anika from Adjust. I've just seen your staff member, John Smith, for the early intervention session. Do you have a moment to talk? And then they'd generally say, yes, I would hope. And then you'd go on to say, great. So what we found was that he had a grade 1 lat tear, which leads me to think, so what we found was that he had a lot of difficulty lifting overhead, and which leads me to think that he has a lat dorsal tear. They reported that they injured it by lifting and twisting with a heavy object. I've done some treatment today, some dry needling, some massage, some manual therapy, and they responded quite well. I've also taped him up so that he's nice and comfortable. Look, I'd recommend another 3 to 4 sessions over the next couple of weeks. And also I've written on the report for him to do no lifting and also to bend and twist as tolerated. If he feels uncomfortable, then he may need to restrict that motion. And then going forward, so if it's less than 6 sessions, which in this particular case it was 3 to 4 sessions. So in this particular case, I'd say, look, I need another 3 to 4 sessions to be able to work on that early rehab of the lat muscle in order to aim to have them lifting normally again by the end of that couple of weeks. Does that sound okay with you? And then you need to make sure that they are happy for you to see them for those number of sessions. You need to then communicate that back to administration if you have had that approved. Now, if you're thinking that it's going to be more than 6 sessions, so let's just say, for example, in this case that we thought that it was a full rupture, big significant injury. So to be something like, look, I actually think that he has ruptured his lats. That's what it's looking like. The bruising is typical of that, and I can see some bunching, and he's really struggling to move properly. Typically, these types of injuries take quite a number of months to rehab, and sometimes we would consider a surgical opinion. We can continue treating. However, I really think it's likely to be at least 12 weeks and, minimum 12 sessions to get him up and running. Do you want us to continue treating under Riviera, or would you like to open up a work cover claim? And in a case like that, they would want to open up a work cover claim. You can even talk about the scans. Look, because I'm thinking that it's a rupture, I really think it's important that we get some scans to confirm that in order to make sure that we're doing the correct treatment to be able to get him back to work. Are you happy to arrange this with the GP? It will likely result in a work cover claim. Is that okay? So they're worth conversations. They're worth preparing for those conversations. So again, with any kind of Riviera, Stratco, any early intervention patients that you're getting, it's important that we hold a really good reputation with these organisations about making good decisions. So again, if you're making decisions and you're not too sure, make sure you see your supervisor for some advice around those decisions and how to approach the phone calls. Okay. Now, remember, a bit like third party, a bit like work cover, communication is key. Please make sure that you communicate to the contact person after every appointment. I know it seems like a lot, but we're very lucky to have these contracts with these organisations. So we need to make sure we're really over delivering for these organisations. You need to make sure that you keep communicating those approved sessions with reception so that they're on top of their side of things with admin as well, and speak to your mentor around any recommendations that you're providing and get those reports checked before sending. These are very important clients to keep on. So we want to make sure that we're supporting you to be able to make the correct decision and not have any tough conversations. Okay. So if there are any questions on early intervention, please see your supervisor, particularly when it pops up. I would dare say that if you do get an early intervention client on your list, that it's important that you actually ask questions straight away. All right, so pre-employment physicals. So these like I was saying, we provide for Village Roadshow, for Visy, for Avanti line marking as well. So these are essentially a comprehensive full body assessment that's completed generally during the recruitment process for these organisations, for positions that require some form of physical capacity. The assessment can also be used for any workers that are returning to work following an injury to ensure that they are completely safe to return to their role before they actually get into the workplace, because we don't want anyone getting re-injured. So the aims of this is to just identify any potential pre-existing injuries or risk of future injuries for a potential staff member that's going on board in a physical capacity. And also the same for any staff members returning to work after injury. We want to try and reduce the likelihood of one of our organisations employing a staff member who's physically unsuitable for the role that they're applying for, because obviously that can lead to a later injury down the track. We want to also make sure that job tasks are appropriately matched to potential staff members or returning staff members. And essentially what we're trying to do with all of those things is reduce the likelihood of injured workers. Okay. So how it works. So the contact person calls Adjust to book in shortlisted applicants normally for pre-employment physical. So for example, someone from Village Roadshow will ring up and say, look, I need to book in a couple of pre-employments with you. And then reception, from an admin point of view, your job is to find slots normally within a couple of days of the phone call. So it's important that we prioritize these patients. So these shortlisted applicants, they attend the clinic. They complete the appropriate written consent forms. So there's special forms that you need people to sign when they come in for these. And then they complete the assessment with the therapist. And from the therapist end, you'll be taken through this practically in your orientation or shortly afterwards. The applicant is then advised that the results will be popped into a summarised report, which will be sent to the recruiter today, and the recruiter will make any decision on any next rounds that are required for the recruitment. And then what happens is obviously the physio completes that comprehensive results report, and on that report, therapist, it will ask you to deem the client either suitable or unsuitable with objective reasoning as to why, and any provisions to solutions. So any specific exercises, mobility, walking program, manual handling, things like that that you might suggest that the client does in order to reduce their risk of injury. That results report is provided to the contact person from the organisation, and it needs to be provided within 24 hours of the appointment. Again, time is of the essence. This is what our organisations will expect of us. They will expect that report within 24 hours. It's important to note that the results are never to be verbalised to the applicant in terms of whether they have passed or failed. You can tell somebody, look, you did XYZ really well or not well, and here's what I'd like you to do, but you cannot tell them excuse me, whether they've passed or failed. The reason for that is that the recruiter needs to decide whether to progress the applicant based on all the information provided, not just the physical report. So if we tell the person, oh, you failed your physical examination, and then they don't get the job, they may well assume that it was just the physical examination as to why they didn't get the role, when in actual fact it could be just that they had 10 other applicants that passed, and it was the one thing that kind of got in the way. Or they might have had multiple people that failed and they just picked the best of the bunch. They also might choose to progress someone who fails as well. So it's really important that we're not revealing that pass or fail to the clients, okay? Because the organizations will get they will not be happy if we are telling the people whether they've passed or failed. Likewise, if we tell someone that they've passed, they might assume that they've got the job, and that's not necessarily what's going to be the case. They're still going through their recruitment selection process, and so we don't want people assuming that they've got their job when they don't already. All right, so the assessment itself, there is pre-employment assessment forms that are provided to you by front desk. They're very, very easy to follow. They are basic sort of range of motion and strength tests that you would be familiar with. So you need to make sure that you run through each one of those tests that are on the page. It is worth practicing this a few times when you do go into your practical workshops during your orientation. Once you've got the hang of these assessments, you can get into a bit of a flow with them. The first time you do them, they will take a little bit longer than what you're expecting them to do. Now, you always run through the first and the second pages of the tests for every single person. That's the whole body assessment part. But in terms of the functional testing, we only test for the position that they're applying for. So there's a number of pages at the back of the assessment that look like this, where it says special tests, please select the position that's required. So these ones here are actually Avanti line markings, different physical positions. So they've got longitudinal painters, transverse painters, water blasters, borum operations, and traffic controllers. Now you can see that some of the different tests for these positions are slightly different from the other. Now, if somebody's applying for a longitudinal painting position, then you would only do these 3 tests. You wouldn't take them through all of the functional tests. You just take them through these these 3 things. And these functional tests are really what determines someone as a suitable or a not suitable applicant for the role. The other 2 pages of testing, all the range of motion, all of the basic core tests, then they are not pass or fail items. We are only really using these 3 tests to decide whether someone's suitable or not. Okay. Some of these tests, I mean, they're labeled, I feel, pretty well, but there might be a few, like a waist height hold, things like that, that you might need some instruction on. And so when you get to your practical session in your orientation, please make sure you ask if these labels don't make too much sense. In terms of filling out the pre-employment assessment report, again, it's pretty straightforward. We're going to show it to you in a second. The template is in Nucal letters. You need to make sure that the comments that you're putting in are accurate. With those functional tests, if they've completed 2 out of the 3 functional tests for that particular role successfully, then we would deem them suitable. If they can only complete 1 out of those 3 functional tests, then they are deemed not suitable. Okay, so if, for example, if we were doing these 3 tests and they couldn't do the lift and squat, or they failed the 1 minute hold of the side plank, but they could do this, so they'd be suitable here but not suitable on 2 out of these 3, the overall result would be that they're not suitable, because they really do require these functional measures in order to be successful in their roles. These tests have been put together specifically with the task matching in their position descriptions. So they really do need to be able to do majority of these tests that we've chosen through here. And then obviously any important findings from the rest of the testing or advice that you gave should be reported in the recommendations/comments section in the report, which I'll show you here. So this is what the report looks like. So you just pop their name, date of birth, what position they're attending, what their position they're applying for, any previous injuries that you have picked up on, your name, and whether they've had a previous work cover claim. We then pop in the results of their step test, which the categories for good, excellent, above average, all those sorts of things are on the test forms themselves. So you just need to match up their heart rate with their age and gender. And in the comments section, you just pop in what's appropriate for how that test went. So, this person was able to complete the test with minor difficulty, was holding a conversation, and what their post-test heart rate was. So just put in what's appropriate for the test. The physical assessment screening, this is all the range of motion testing that we go through with each person. So any general observations that you picked up on that you want to note, any particular range of motion, if they were good overall, you can just quite literally write that. If someone was particularly tight in one hamstring, you might choose to note it in there. They were tight on their left hamstring. It looks like this is the reason why. But typically people are pretty good. We note down their group strengths as well. And then we get to the functional section. So we've got our core and balance tests. And again, you would just comment on how they went with each of those tests on the forms. And then these are the job specific tasks. So those ones there are the 3 functional tests that you would choose to do based on which position they're applying for. So again, you're just putting in what the tests were, whether they were normal or abnormal, and comment on how they went. So for this person, because they were able to complete their 3 sessions, they would be deemed suitable for this position, to be like, so and so has met the requirements for the warehouse position, would be suitable for the position, demonstrated good cardiovascular endurance, da 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 da. If there were other things in there that you wanted to comment on, like, say for example, their step test wasn't very good, but that's not a pass or fail thing. So you'd still say, look, they're suitable for the position, but I would recommend that they complete a walking program. I've given them some advice on this in order to work on their cardiovascular endurance or something like that. So you just put in any of your recommendations in there. If you're deeming someone unsuitable, it needs to be very clear why they're not suitable for this position because they failed 2 out of the 3 job specific tasks. I've recommended XYZ for them to work on those issues. Okay. So again, any questions about pre-employments? And certainly when you get your first one, make sure you see your supervisor for. This is straight out of your onboarding pack. It's your little quick reference guide. It just has our little corporate clients in there, which types of services we provide to them, and who the contact name is in through there, just so that you're aware. Okay, so that is our corporate services. I hope that all made sense, but obviously if it didn't, just let us know and we will help you out. All right, thanks. Bye.